The normal blood pressure of an adult is 96 degree Fahrenheit, 97 degree Fahrenheit, 98.6 degree Fahrenheit, 99 degree Fahrenheit. The correct answer is option C, 98.6 degree Fahrenheit. The average oral temperature is 98 degree Fahrenheit, representing normal thermoregulation. The normal pulse rate in adult is 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A healthy adult pulse lies between 60 and 100 beats per minute. The functional unit of kidney is neuron, nephron, alveolus, axon. The correct answer is option B, nephron. Nephrons filter blood and form urine, regulating fluid and electrolyte balance. Next question. Normal blood pressure of an adult is 100 by 60 mm of Hg, 110 by 70 mm of Hg, 120 by 80 mm of Hg, 140 by 90 mm of Hg. The correct answer is option C. 120 by 80 mm of Hg is accepted as a normal adult BP. The normal respiratory rate in adult is 10 to 12 breaths per minute, 12 to 20 breaths per minute, 20 to 30 breaths per minute, 30 to 40 breaths per minute. The correct answer is 12 to 20 breaths per minute. First aid for heavy bleeding is apply ointment, apply direct pressure, wash wound, B. Give water. The correct answer is option B. Apply direct pressure. Direct pressure helps control bleeding quickly. The normal range of hemoglobin in females is 8 to 10 grams per deciliter, 10 to 12 grams per deciliter, 12 to 14 grams per deciliter, 14 to 16 grams per deciliter. The correct answer is option C. Option C, 12 to 14 grams per deciliter. Average HP in females 12 to 14 grams deciliter, in males 13 to 15 grams per deciliter. The main function of RBC is clot formation, oxygen transport, fighting infection, hormone secretion. The correct answer is option B, oxygen transport. Hemoglobin and RBCs carries oxygen to body tissues. Which vitamin helps in blood clotting? A, C, K, E. The correct answer is option C. Vitamin K is essential for synthesis of clotting factors. The normal pH of blood is 6.8, 7.0, 7.35 to 7.45, 8.0. The correct answer is option C, 7.35 to 7.45. Blood is slightly alkaline, maintained by buffer system. The functional unit of the nervous system is neuron, axon, brain, spinal cord. The correct answer is option A, neuron. Neurons transmit nerve impulses throughout the body. The main organ of respiration is heart, lung, kidney, liver. The correct answer is option B, lung. Lung exchange gases, oxygen and carbon dioxide. Pulse is felt due to heart contraction, valve movement, arterial expansion, venous flow. The correct answer is option C, arterial expansion. Pulse is a rhythmic expansion of arteries during each heartbeat. Which organ produces insulin? Liver, pancreas, spleen, stomach. The correct answer is option B, pancreas. Pancreas beta cells of islet of Langerhans secretes insulin. The basic unit of life is tissue, organ, cell, system. The correct answer is option C, cell. Cell are the section and function unit of all living organism. The process of breathing in is called expiration, inspiration, inhalation, respiration. The correct answer is option C, inhalation. Inhalation, drawing air into the lungs for gas exchange. The main artery of the body is pulmonary artery, aorta, vena cava, carotid. The correct answer is option B, aorta. The aorta carries oxygenated blood from the left ventricle to all body parts. The human heart has how many chambers? 2, 3, 4, 5. The correct answer is option C, 4 chambers. Heart has 4 chambers, 2 atria, 2 ventricle for double circulation. The first cervical vertebrae is called axios, atlas, coccyx, lumbar. The correct answer is option B, atlas. Atlas supports the skull and allows nodding movement. The main function of the lung is pumping blood, gas exchange, food digestion, hormone production. The correct answer is option B, gas exchange. Lung exchange oxygen and carbon dioxide between blood and atmosphere. The pulse rate increases during sleep, fever, rest, cold. The correct answer is option B, fever. Fever raises metabolic rate and therefore pulse rate. The smallest bone in the body is femur, stapes, ulna, tibia. The correct answer is option B, stapes. The stapes in the middle ear transmit sound vibrations to the inner ear. The part of the brain controlling respiration and heartbeat is cerebrum, cerebellum, medulla oblongata, thalamus. The correct answer is option C, medulla. Medulla oblongata regulate vital involuntary activities like heartbeat and breathing. The bone protecting the brain is rib, skull, spine, pelvis. The correct answer is option B, skull. The skull cranium encloses and protect the brain. The largest part of the brain is cerebrum, cerebellum, medulla, pons. The correct answer is option A, cerebrum. Cerebrum controls intelligence, memory, voluntary actions. The fluid protecting the brain and spinal cord is lymph, cerebrospinal fluid, plasma, pericardial fluid. The correct answer is option B, cerebrospinal fluid. CSF cushions and nourishes the brain and spinal cord. Which is a hinge joint? Option A, shoulder, knee, hip, neck. The correct answer is option B, knee joint. permits movement in one plane, flexion and extension. The pulse felt in the neck is called radial pulse, femoral pulse, carotid pulse, temporal pulse. The correct answer is option C, carotid pulse. Carotid pulse is used during CPR to assess circulation. Normal range of respiration for a newborn is 20 to 30 breaths per minute, 30 to 50 breaths per minute, 50 to 70 breaths per minute, 70 to 90 breaths per minute. The correct answer is option B, 30 to 50 breaths per minute. Newborn breathe faster, about 30 to 50 breaths per minute. The universal donor blood group is A blood group, B blood group, AB blood group, O negative blood group. The correct answer is option D, O negative blood group. O negative blood can be safely given to any recipient. The study of tissues is called histology, cytology, anatomy, pathology. The correct answer is option A, histology. Histology deal with microscopic study of tissues. The main function of white blood cells is oxygen transport, clotting, immunity, energy storage. The correct answer is option C, immunity. WBC protect the body against infection. The largest part of the digestive system is stomach, small intestine, large intestine, rectum. The correct answer is option B, small intestine. Small intestine, site of digestion and nutrient absorption. The smallest unit of nervous system is brain, neuron, axon, synapse. The correct answer is option B, neuron. Neuron transmit nerve impulses. Which organ stores bile? Liver, gallbladder, pancreas, spleen. The correct answer is option B, gallbladder. The gallbladder stores and releases the bile produced by the liver. The condition of low blood sugar is called hyperglycemia, hypoglycemia, anemia, hypoxia. The correct answer is option B, hypoglycemia. Hypoglycemia, deficiency of glucose in bloodstream. The primary site of protein digestion is mouth, stomach, small intestine, large intestine. The correct answer is option B, stomach. Pepsin enzyme in stomach begins protein digestion. The enzyme that digests fat is amylase, lipase, pepsin, trypsin. The correct answer is option B, lipase. Lipase break down fat into fatty acids and glycerol. The normal range of blood glucose fasting is 40 to 80 mg per deciliter, 70 to 110 mg per deciliter, 110 to 150 mg per deciliter, 150 to 200 mg per deciliter. The correct answer is option B, 70 to 110 mg per deciliter. Fasting glucose level is 70 to 110 mg per deciliter in healthy individuals. The average adult has how many bones? 200, 206, 208, 210. The correct answer is option B, 206. The adult skeletal has 206 bone providing structure and protection. The largest gland in the body is pancreas, thyroid, liver, and adrenal. The correct answer is option C. Liver aids metabolism, detoxification, bile production. The bone forming the forehead is frontal, parietal, temporal, occipital. The correct answer is option A, frontal. Frontal bone forms the forehead and upper part of the eye sockets. Which organ purifies blood in the body? Heart, kidney, lung, liver. The correct answer is option B, kidney. Kidney filters metabolic waste and maintain water electrolyte balance. Which blood cells helps in blood clotting? RBC, WBC, platelet, plasma. The correct answer is option C, platelets. Platelets or thrombocytes help form clots and prevent bleeding. Universal recipient blood group is O positive blood group, AB positive, A positive, D positive. The correct answer is B. The correct answer is AB positive. AB positive can receive blood from all groups. Universal recipient blood group is AB positive. AB positive can receive blood from all blood groups. Thank you all.